Today is World Breast Reconstruction Day, and a lot of women are not aware that insurance covers breast reconstruction. That's if insurance plans cover a mastectomy. Joining us is Hartford healthcare breast surgeon Dr. Valerie Brutus with St. Vincent's Medical Center. Doctor, first of all, thank you so much for being with us today.
Good morning. Thank you so much for having me.
Great to have you here, and you are a breast surgeon. Talk to us about how you advise women on breast reconstruction. There are a lot of questions that patients must have who can't undergo reconstruction as well.
Absolutely. I think, when I consult patients, it's always important to discuss first if they want breast reconstruction and if they decide to have breast reconstruction, what type of reconstruction they have. It's important that women understand that there's different types of reconstruction. So once the breast can be reconstructed, with your own tissue, or the breast can be reconstructed with an implant that it can be made out of silicone or saline.
And there are people who can't undergo reconstruction, as mentioned as well. What do those patients have? What kind of options do we have?
That is correct. So the patient that cannot have reconstruction or patient that present with inflammatory breast cancer or patient that present with what we call locally advanced breast cancer, and it's also important to consider the patient overall health. So patients who have, severe heart disease or lung disease, smokers, or those patients that you can perhaps, consider to talk about them about not having reconstruction or having delayed reconstruction once their medical conditions are stabilized.
Can you talk to us about the process leading up to breast reconstruction? Is there kind of a screening process? What should patients know if this is something they're going to be doing?
Well, I think all patients who require to have a mastectomy as part of their cancer treatment are candidate to have breast reconstruction surgery. We always talk to them about the different types of reconstruction, and it's important that they meet with a plastic surgeon to discuss, what the reconstruction entails and see if they want to proceed.
And I know you work closely with a team there. How does this all come together? How many people are working with the patient to make sure that this is a smooth process?
We have a big team. So once usually I meet the patients first, and we talk about the patients are consult about having breast reconstruction. Then they see our plastic surgeon. We have the plastic surgeon have a dedicated nurse, physician assistant, and everybody talk, together to educate the patient about the types of reconstruction. And if the patient decides to go, then we coordinate the surgery so we can work together to offer the patient, the best possible outcome. A lot of time the reconstruction is done at the time of the mastectomy and does, offer the patient a very good cosmetic result.
Well, it's just nice to know that there are options for everyone out there. I want to thank you so much for being here, Dr. Valerie Brutus, on World Breast Reconstruction Day. So many questions surrounding this for a lot of women. Appreciate your time here to help clear some of that up. Thank you.
Thank you very much. Have a nice day.